So in the past few years, a lot of our clients are choosing new primary care doctors. A lot of primary care doctors are baby boomers. They're also retiring. Also, we're seeing the increase of corporate medicine where doctors are employees. They can get laid off if they don't meet their numbers. Or in certain cases, if practices are not profitable, they can simply shut down. Recently, in one of our markets up in the Northeast, what happened was a really prominent medical practice. They've been around for decades. Simply said, we're closing our doors and everybody find their own doctors. And it's about 20,000 patients. So a lot of people are struggling to find doctors that will take them. And what we're finding out is that a lot of our clients who can afford to do so, they're choosing concierge doctors. So concierge doctors are doctors that take cash. It's usually on a subscription basis. So you pay them monthly or yearly. And you can see them anytime. You can have access to their cell phones. You can call them. You can email them. Do FaceTime video conferencing, and it's a really convenient way to access primary care. A lot of people like it. And what we're also finding out is that there's some restrictions, especially for Medicare clients, that they need to be aware of when choosing a new primary care doctor, especially if they are a concierge doctor. So Medicare, most providers are in the Medicare system. So over 90% of providers are in the Medicare system, and that number is even higher for specialists. However, if somebody's in the Medicare system, there are some restrictions. So Medicare says that any provider that takes Medicare cannot individually arrange a financial relationship with patients outside of the Medicare system that doesn't adhere to Medicare guidelines. And what that means, long story short, is that if a concierge doctor is still taking Medicare patients and is in the Medicare insurance system as a provider, then they typically cannot take on a concierge patient and charge a subscription fee monthly or yearly for their services. And what that means is that a lot of concierge doctors are saying, well, we're not taking any patients who are on Medicare. So that can be pretty restrictive. So what happens is that if you're on Medicare and you need to find a doctor and you would like to use a concierge doctor, whether it's a MD VIP, deep direct primary care or whatnot, you got to make sure that doctor has opted out of the Medicare system, which means that they're not in the Medicare network. They don't take any money from Medicare. And if that's the case, then they can still see you even though you're on Medicare. You just got to make sure that you also choose a plan that's going to work well with a doctor that's not in the Medicare system as your primary care doctor, a plan that doesn't require any referrals and a plan that doesn't have restrictive prior authorizations that's going to need a primary care in the system to file those authorizations. Although prior authorizations, that's a little tricky. Some carriers, what we found is that some insurance companies will allow outside doctors to do prior authorizations, but not do referrals. And again, that's a little bit of a case-by-case basis. So that's why it's important to really dig deep into the specific plans that you have to see if they're going to work well with your doctor, especially if you're on Medicare and you want to go the concierge route.